Machaga Johns. Not a health professional, technically of the mental health sort, but I am a certified massage therapy practitioner, and I am also a mental health recovering patient. Today we're just going to kind of talk about my ability to kind of help myself recover, sneak techniques that don't involve a lot of medicine if you're not about that, things that help you understand that you're still yourself. Basically, I know that my perspective is coming from an injury view. A lot of times we just get so hurt we don't have the composition to basically handle a lot of mental challenges. And from that, you find yourself in certain mental health situations where you're going to need to practice better care for yourself. You'll have to put up safety guards. You'll have to start taking medicine, things that a lot of people aren't used to taking, things that aren't, a lot of new information that people aren't ready to actually handle even at that time of actually coming out of the hospital as an outpatient. So basically the struggles are totally real. You can try and time it yourself. A lot of times there just isn't enough time to basically go on your own time frame. So you have to do it the best way you can. What I found out is to try listening to music a lot. I had to saturate myself with things that are food-wise healthy, that I don't gain more weight, that cause more problems to my health. A lot of it was a struggle for me, mostly in the mania area, just really manic. I could fly easy, I could tear off easy, I could wear my clothes, I could not wear my clothes, I could do anything really fast. And that was most of mine. I didn't really deal with a lot of the depression side some people might find that comes along. So basically over time I had my problems with my medicine and trying to take my medicine. The dosage was usually wrong to me. I was usually way too high. I was way too clotty. I was way too clogged inside. I was way too saturated, way too lethargic. So a lot of my struggle was about figuring out what the right dosage was. I'm just getting there now, and it's probably around 17 years or almost 20 years now. So I mean, it depends on what kind of person you are, what kind of family background you have, your supports that help you basically evolve out of, or at least help you maintain some sort of stability within your mental health situation. Daily health and maintenance. Daily health is very big, actually. It's probably your biggest technique. It doesn't always involve taking your medicine, although your doctor will always probably prescribe you to take your medicine. The funny thing about that is you don't always remember. So getting your start of your day may not be having a cup of coffee first. It should be maybe brushing your teeth first. Simpler things that don't require you to have to usually buy something first. Like most people get up and buy a cup of coffee when they've forgotten maybe their medicine, instead of maybe going to their cabinet and remembering that there's actually a cup of coffee in there for them already. Stuff like that. So maybe if you start with changing your socks before you start your day, or brushing your teeth, those are the two probably easiest things you could probably get to really quick, that's really cheap, that will start your day differently. A lot of times we have breakfast first, and you can kind of, maybe skip breakfast and brush your teeth first. I mean, the combination is probably the orange juice, but I mean, if you can get past the orange juice, you'll probably have a better day anyway. And you'll have your orange juice. It's just, getting started past the dirt and the grime and then starting fresh. It's a lot about getting fresher for the day. You can't kind of stay in the past where we fall into the habit of grieving and you're starting to fall into other mental health issues like depression. It's easy to fall into anxiety from rolling from stress. So those are easy things that anybody could ever find. Everybody knows that stuff mostly. Simple changes, which was another big thing for me, kind of trailing towards the end, that it's probably a little more gratifying to have something you can play with, like cards. Games that you can maybe handheld, mostly handheld games, or cards, solitaire. If you can get to an internet, those are other things to kind of take your mind off the stress. You can kind of combat by, picking certain cards. It doesn't matter if you win technically when you're doing this, because actually you're just doing it for better health. So if you kind of see the scheme of things, that you kind of can play yourself to your health as well. That's the other technique. So those are the three techniques basically that I pretty much use the entire time. Besides dying everywhere on medicine because I just wasn't good at it. I died everywhere. Definitely, the clarity from my profession is basically the best thing that I have. I can totally see a lot of things being wrong with, people taking a lot of medicine, a lot of things about the common cold. My view and my opinion changes daily, basically, but my view is totally clear that, certain things are totally pick apartable. There isn't always a necessary definite, indefinite need for all the medicines that we basically try to procure for ourselves. The best thing that I find is trying to stay close to being yourself. It's a lot of interpersonal dealing, and so it's not always about medicine. It's not always about Eastern medicine. It's not always about dressing like somebody or personifying yourself to be like somebody else to get better health. It's a lot about you personalizing yourself. So I mean, finding out who the heck you are is a lot of the big mission too. So I mean, that's how we end up with years and years of trying to get out of these mental health issues. Really, and it just takes forever. You just don't seem to find the time, and it's pretty horrific at some points. And you come close to thinking about death a lot. And they say, and even I've dealt with the suicidal issues of mental health as well, because you kind of can't sit in that same position all the time, not progressing daily. I mean, when you find yourself sagging back and you're like, I'm 2 days old, I'm 3 days, after a while you're just too old. You don't care. You don't want to deal with it. You're kind of out of wits. You know what I mean? When you're out of ideas, there's not a lot of places you can go. And that's what we try to, it's pretty much the majority of the fight. It's not to end up alone by yourself with it. So. At this year and age, it's actually very old to me. So my strengths are probably a little stronger as I come up to you on the camera. Like I said, it's been almost 20 years, and I also have my healthcare practice as a professional massage therapy person. The best thing I would like to tell everyone that when it comes to really dealing with your personal issue as far as your health concern is, you definitely want to take care of yourself. I don't want to advise you to start putting yourself before people, but actually you do want to take care of yourself before others is the best way I could tell you that. It's not a lot about, the atmosphere or who's around you. It's about you and who you were. And that's the best way to track yourself all the way back to where you basically started to fall apart. With that being said, I hope that you continue to basically practice better health care practices, such as eating good, taking care of yourself cleanly wise, because actually cleanliness makes you feel better. It's invigorating. It's actually very nice to take a shower sometimes. You might have to borrow some of the flowery stuff because it gets too dry. I'm just going to tell you that it's easier for you to feel invigorated if you take a light fruit bath. I'm just going to tell you that. Just take a break. I don't say you have to get into the candles and love yourself up to the T, but it will help that you relax every once in a while with something different. And differences actually create the changes that we need to basically evolve maybe back or to a person that we want to become.